Hello everyone, I'm Dr. Anuj Chawla. I'm a foot and ankle specialist at Birla Hospital, Gurgaon. So today we are going to talk about a very important yet one of the most neglected problems in the toes, which is called as bunion. In medical terms we call it Hallux Valgus. So first of all, what is Hallux Valgus? Let us learn from this foot model. So Hallux valgus or bunion is basically a prominence of the bone in the inner aspect of the toe. So what happens is that the big toe or the great toe or the first toe, it starts deviating towards the lesser toes, basically outwards, and as a result this bone, which we call as first metatarsal, starts deviating medially or inwards. This leads to a big prominence of bone around this area, and we call, in layman term, we call it as bunion. Normally the symptoms arising from the bunion can include pain, which is there at the medial aspect or the inner aspect of the bunion, which we call as a bunion pain. Sometimes pain in the lesser toes, which can happen due to excessive overloading of the lesser toes as the big toe or the first toe is not functioning very well. It can also lead to certain deformities in the lesser toes, which we call as hammer toes. And also one of the most important thing is that it leads to cosmetic displeasure to the patient. So why does bunion happen? Bunion, the most common reason for having a bunion or a hallux valgus is a positive family history. So if you have someone who is suffering from bunion, there is a possibility that you might be more predisposed to it as well. Women are more common to have hallux valgus. Apart from that, certain inflammatory conditions like rheumatoid arthritis or some neuromuscular disorders like cerebral palsy, patients would have a higher chance of having a hallux valgus or a bunion. The only modifiable risk factor which is associated with hallux valgus is wearing shoes which are narrow from the toe end, or we call them as narrow-toed shoes, because that leads to crowding of all the toes towards each other, and that predisposes the patient to have a hallux valgus or a bunion deformity. So now let's go to the treatment for hallux valgus or bunion. Unfortunately, there is no non-medical treatment which can actually cure the deformity or which can straighten the big toe, but yes, there can be things that we can do to reduce the symptoms. So normally if you have pain which is excessive over the bunion region, ice packs, taking non-inflammatory medicines, or applying some local ointments can help in relieving the symptoms. Apart from that, there are certain things called night splint or toe separators which can try to align the foot towards the normal and away from the lesser toes, which would reduce the pressure on the lesser toes as well. And if you are suffering from lesser toe metatarsalgia, then insoles with metatarsal pads can also help in reducing those symptoms. However, if all these things are not really successful, then the last resort is normally a surgery. When we talk about surgery for hallux valgus, it is mostly done for patients who are suffering from pain, and it is not normally done for just cosmetic reasons. The surgery in the earlier cases involves cutting the bone and realigning it together, along with release of the tissues on the outer side and reinforcement of the tissues on the inner side of the big toe. You can walk immediately after the surgery, and you're supposed to wear special shoes for around 4 to 6 weeks. However, if the deformity is really very significant, or if there is certain thing called as instability in one of the joints, then sometimes a fusion surgery is done. The disadvantage of a fusion surgery is that you lose the movement in the big toe, but it helps in relieving the symptoms and no chance of recurrence. So if you think that you or any of your family member is suffering from bunion, you can always take an appointment with us. Thank you very much.